Hello everyone, welcome to Community Medicine Insight. In this video, we will discuss the details of pentavalent vaccine. What is the schedule of this vaccine, how it is given, and what are the different side effects, and what are the cold chain requirement of this vaccine. Here, the pentavalent vaccine was introduced in a phased manner starting in the year 2011, and then later it was expanded nationwide, which is being completed by the year 2015 under the Universal Immunization Program. Why this vaccine was introduced? The introduction of pentavalent vaccine has expanded the protection because this vaccine protects against the 5 killer diseases, which are diphtheria, pertussis, tetanus, hepatitis B, and Haemophilus influenzae type B. Earlier, the Hib vaccine was very expensive and it was mostly available in the private sector. It was not included under the UIP. Introduction of this vaccine has also reduced the number of pricks to the child. That leads to the better coverage of the vaccine, decreased number of dropout, and better logistics. So it is also cost effective for the health system. So the advantages of pentavalent vaccine includes the reduced number of injections, improved compliance and the coverage, decreased dropout rate. It is cost effective for the health system also, and earlier we were not including the Hib vaccine in the UIP. So its inclusion protects the pneumonia and the meningitis which is caused by the Haemophilus influenzae type B. Coming to the composition of pentavalent vaccine, it consists of diphtheria toxoid, whole cell pertussis, tetanus toxoid, hepatitis B, Haemophilus influenzae conjugate vaccine. So it has 5 antigens. And important point here is India uses whole cell pertussis rather than acellular pertussis. Coming to the schedule of pentavalent vaccine under Universal Immunization Program, the primary doses includes 3 doses at 6 week, 10 week, and 14 week. No booster doses of pentavalent vaccine are given, and after the age of 1 year, we are giving DPT booster, not the pentavalent booster. And the formulation which we are using in the UIP is liquid formulation. The dose of this vaccine is 0.5 ml and the route is intramuscular, so given on the left anterolateral thigh in infants. Why we are not giving injection in the gluteal region in infants? Because there is a risk of injury to the sciatic nerve, and because of fat present in the gluteal region, there is a poor absorption of the vaccine. So these figures represent the correct technique of giving the intramuscular injection, and this IM injection has to begin at an angle of 90 degrees. This slide shows the sequence of vaccination. We have read earlier that the pentavalent vaccine is to be given on the left side on the anterolateral aspect of thigh. The other vaccine which we give at 6 weeks include OPV, Rota, FIPV and the PCV vaccine. At 10 weeks, we give OPV and Rota along with the pentavalent. At 14 weeks, again, we have to give OPV vaccine, rotavirus, FIPV, PCV vaccine along with the pentavalent vaccine. This vaccine need to be stored at +2 to +8 degrees centigrade, and it is freeze sensitive also. So the shake test is applicable due to the DPT component. If we have to discard if the vaccine is being frozen, and before giving the vaccine, we have to check the Vial status like we check while giving the other vaccines as well. Discard if the vaccine vial monitor reaches the discard point. It means if the color of the inner square matches with the color of the circle or it is darker than the circle, then we don't use the vaccine. Pentavalent vaccine follows the open vial policy, so it can be used up to 28 days once it is opened if the cold chain is maintained, the vaccine vial monitor has not reached the discard point, and the aseptic technique has been maintained. Now this is a very important viva question, that till what age we can administer the pentavalent vaccine? Then the answer is 1 year. Only till 1 year we give the pentavalent vaccine. Now few scenarios may occur, like if a child comes unimmunized after completing 12 months of age. Instead of the pentavalent vaccine, we have to give the 3 doses of DPT vaccine and a booster after the gap of 6 months. But if a child has received 1 doses of pentavalent vaccine before his or her birthday, in that case, we have to complete the remaining doses of pentavalent vaccine with a minimum gap of 4 weeks. So, if a child of age more than 1 year comes to the clinic with no immunization and the child has not received any dose of pentavalent, then we have to start the schedule with the DPT. In that scenario, we will not give the pentavalent vaccine. But if a child has received at least 1 dose of Pentavac vaccine before the first birthday, then we have to complete the schedule with the remaining doses of Pentavac, and we have to maintain a minimum gap of 4 weeks between any 2 doses. Although we are giving DPT and hepatitis B in the pentavalent vaccine, still we are giving these vaccines separately, as the birth dose of hepatitis B is given at birth within 24 hours of birth in the case of institutional delivery, and we are giving DPT booster at 16 to 24 months and again at the age of 5 to 7 years. What are the reasons where we should not give a child pentavalent vaccine? A child below the age of 6 weeks will not be given the pentavalent vaccine. A child who has a severe allergic reaction in the past should not be given. And the children with moderate or severe acute illness should not also be administered the pentavalent vaccine until their condition is improved. And the minor illnesses like URI is not a contraindication to the vaccine. So contraindication include only those conditions where there is a history of anaphylaxis to the previous dose or the component of the vaccine, and there is a encephalopathy within the 7 days of previous pertussis vaccine. The adverse event following immunization in case of pentavalent vaccine, the common one includes the pain, redness, swelling, and the mild fever and the irritability. The uncommon one include the persistent crying or the high fever. Rarely but sometimes the anaphylaxis or the hypotonic hyporesponsive episode can occur.